As early as 6 December 2013, the well-being of the people in Napak district has been worrying health officials after the Uganda Virus Research Institute confirmed that there was an outbreak of hepatitis E.
As a ministry, we started following it up. To date, we have about 344 registered cases of hepatitis E within the district.
Most of these are assumed to have died because of liver failure, which is the worst stage of hepatitis E.
Hepatitis E is a viral infection that starts initially with a viral illness, a flu-like illness. You get fever, you get headache, and then you get nausea and vomiting. Later on, individuals develop yellowing of the eyes, of the body.
The National Task Force from the Ministry of Health has already sent a more comprehensive team of specialists. In fact, of the 13 reported deaths, 10 were pregnant.
Pregnant women usually have reduced immunity, and therefore the illness tends to take a more severe course in them rather than in the other groups of the population where it is a bit more gentle.
Pregnant women can easily pass it on to their fetuses. The over 20-member team in Napak will look at health education in the area while focusing on the main source of infection, contaminated water and general poor sanitation in the area.
Feces have to be disposed of in the required and standard way. We have to ensure that people use pit latrines. Hand washing is paramount after toilet.
Most people in this district and elsewhere in Karamoja are not helped by the fact that they drink the blood of animals, and some eat raw meat, which is also a source of infection if the animal drank from a contaminated source.
I'm meant to understand this is a disease which, has no cure. So what do we do in terms of treatment if someone really has the virus?
Treatment for hepatitis E is mainly supportive. In the early stages, we give supportive treatment for the fever, for the nausea, for the vomiting, and also support the diet of the person.
Apart from Napak, other districts with isolated cases include Moroto, Nakapiripirit, Kotidu and Katakwi. In northern Uganda, where most cases of hepatitis were registered in 2007, some areas in Acholi sub-region have markedly improved in latrine coverage.
As Ministry of Health, we have been trying to assess the magnitude of this problem and also to address it.
According to the World Health Organization, worldwide each year, there are 20 million infections with about 50,000 related deaths. Now, even when the preventative measures are known and they have been told to these people constantly, Karamoja is an area which has suffered with sanitation and hygiene. There are even some people who believe that mixing of feces is a taboo. So they do not believe in constructing latrines, lest they come together and use those toilets. Now the problem is that outbreaks are going to continue in such areas. Flores Salimba, NTV.